Aurora and Luna Day have a problem state lawmakers thought they had fixed.
Here, let's throw it in there. All right.
Both girls have serious medical conditions. And the legislature created a program to move them from state-run Medicaid, which covers children in low-income households,
Thank you.
to an affordable alternative. But when the state cut off their Medicaid, they discovered the affordable alternative did not kick in as lawmakers planned.
And we'll be able to close this one up.
And that's how their father, Donald, maxed out his credit cards.
Instead of moving forward, we've just been going back.
And it's why Donald, Aurora, and Luna are packing up and losing their home.
This is going to be very hard for me because, I love this house so much.
Donald's a single dad of 2 girls with cystic fibrosis, a rare digestive and lung disorder that requires a lot of attention.
My treatments take 45 minutes for their lung therapy. That's twice a day. So every time they eat, they have to take medicine for that.
And when they get sick, they can wind up in the hospital for days, or for Luna, nearly 2 weeks.
I was crying because I missed her so much because she's always been in my life.
Aurora, Luna, and more than 460,000 Florida kids lost Medicaid because rules changed after the pandemic, and the state determined their families earned too much income to keep their coverage. Now, for context, Donald is bringing home around $3,400 a month, which the state considers a bit too much. Now, let's do some basic math. Zillow shows the median rent for 2 bedrooms in Tampa is nearly $2,000, which is close to what Donald was paying, plus electric.
Ballpark would be 180 on average. And then water is always like 90.
Plus transportation.
My gas only runs me like $50 a week.
That's another $216 a month, plus car insurance, which costs more when you're in debt.
My car insurance is $300 a month.
That leaves around $614 a month for food and everything else for this family of 3, or less than $7 a day for each of them, before the girls lost Medicaid. Remember this number, $614 left over. We're going to come back to that in a moment. First, the legislature knew the Medicaid cuts were coming, and they passed a bill in 2023 to expand the state's subsidized kid care insurance, also known as Healthy Kids, starting January of 2024. Aurora, Luna, and others losing Medicaid were supposed to be able to switch over to that for premiums of $15 to $20 a month.
I was glad to see that they were going to do something to help.
But then the state sent out letters that confused people.
The way they word things is really weird.
For example, they state Medicaid is ending, and the reason that it's ending is that it's ending, while also stating you or a member of household remain eligible for Medicaid under a different Medicaid coverage group, while also noting household income is too high to qualify for this program, and you're receiving the same type of assistance from another program.
Yeah, it's just scattered. The words aren't in the right place.
The good news is that you have it. The bad news is that you don't have it.
Right.
Until you do get it, except you don't have it.
Correct. Yeah. And you'll have it, but you'll be told you don't.
That led some to take no action, assuming they had some form of coverage when they didn't, and it led others like Donald to apply for the kid care expansion, which he discovered did not expand due to problems in the state's paperwork.
I don't understand what's been the holdup with moving forward with this over some paperwork.
Well, you read their letters, right?
Yeah.
How can that surprise you?
This is true.
Well, the federal government would pay for most of the expansion, so the state had to submit forms to the feds. And here's Georgetown University health professor Joan Alker on what went wrong.
States have to get what's called a Section 1115 waiver to expand their Healthy Kids or their CHIP programs. It appears that the state was not aware of that for quite some time. And then when they finally did figure that out and get around to filing their application, they made a lot of mistakes.
That delayed it for months. And then the state sued over federal rules requiring kid care recipients to have at least 12 continuous months of coverage.
This is a new protection that Congress put in place, and it came into effect January 1st of 2024.
That stalled it indefinitely.
Now, Florida is the only state in the country that is challenging that new federal protection.
A federal judge in Tampa dismissed the state's lawsuit in May, but the state is planning to appeal and leaving the expansion on hold.
It got to the point where I'm like, all right, what are we eating right now? You know, can I borrow money, for food?
Given the need, Donald decided to get kid care for both of his daughters without the subsidies. So instead of paying $30 to $40 per month as intended, he's paying $520 per month, plus co-pays for doctor visits, prescriptions, and more.
Each kid takes a range from 8 to 10 different medicines. So it's just like compiling, and it's only $5, but when there's like 20 to 30 of those $5, it adds up.
That all adds up to another $600 to $700 a month. And remember, our math showed they only had around $614 a month for food and everything else. And one more thing. The girls did get approved for Social Security payments, which helped a little at first. But then Social Security told them they approved payments by mistake. And now, on top of everything else, the feds are demanding more than $8,000 in repayments due to problems in their paperwork.
In a time when my family needed help, I thought I was getting help, just to find out that, they want to take the help back.
And it's why they're moving out of their home to live with Aurora and Luna's grandmother.
There are a lot of days where I'm ready to give up, a lot of days like that. But I can't, not with my kids. There's no giving up.
On that point, Aurora said her dad protects them like her favorite animal, a wolf.
And I made a perfect one for Dad because I really loved him.
And she said she colored it this way to add rainbow power, to give him a boost in a really hard time.
He's like very, very sweet to us, so I really love him.
Well, in Florida, children only qualify for Medicaid if their family is within 133% of the federal poverty line. Those who come within 200% can get low-cost kid care insurance, but it was supposed to expand to 300%. That is where it stalled, and it's why the Day family and thousands of others are missing out. Craig Patrick, Fox 13 News.